So good evening, everybody, and thank you for joining us for tonight's webinar. My name is Sofia Araúz. I'm the Scientific Director for Treaty Predict, and we're very happy to have you here tonight. I really hope that you're going to find the information that we're going to share very useful for your clear aligner practice. There are going to be certain things that are really going to blow your mind. It really blew mine at the time that I learned it as a general dentist. So please feel free to jump in with questions at allocated times or send them to the general chat. You also can send them directly to Chelsea Morales, who is on the call. She's our great customer support representative. You may have worked with her in the past. So please feel free to send her a direct chat or drop your question on the chat. If we need more clarification, we'll unmute you so you can ask more questions. So I'm going to proceed to share my screen. So tonight's webinar is about setting yourself up for success with the right aligner case. A little bit about me, I already mentioned I am a general dentist. I got my DDS at Universidad de Panamá. Panama is where I'm originally from. I also completed a GPR there, and then an AGD residency and fellowship at the University of Connecticut. I have been in general dental practice for more than a decade. I was also faculty for UConn for the dental students and also for the AGD residents. I also worked for GSK as a medical affairs senior scientist for Sensoran and Pronamo. And then 3D Predict found me and I couldn't say no because it was such a great opportunity. This really is the future of dentistry, not only of orthodontics. And I really hope tonight you will be able to see how you can really integrate clear aligner practice as part of your everyday dental practice. So like I said, questions are welcome. Please don't be shy. And a little bit of for agenda for tonight, we have a packed agenda. We're going to chat about a little bit on 3D Predict because I know some of you may be new to our technology, so it's important to understand how we are different. Also, we're going to talk about defining your goals, which is the base of everything we do in dentistry. Clinical and financial, because we're in the business of dentistry, so finances are important. We're also going to talk about your ideal started aligner cases, because I understand most of us didn't learn aligner treatment in dental school. So nobody went to start doing implants if you're doing implants, starting with full mouth reconstruction, right? You are starting with one implant and probably it's going to be a posterior implant. So it's the same thing with aligners. You need to start with simple and move on to complex. Now, because we are a company that integrates CBCT, if you do submit a CBCT, a lot of our customers ask us, when do I need to submit a CBCT? We're going to be answering that question too. And we're going to be seeing some case examples. So a little bit about 3D Predict. Now, we do happen to make aligners. And I say this because we are first and foremost a technological company, an AI company. We have been in the business of AI for more than 10 years. We were the pioneers related to AI in the ortho world. This sets us apart from everybody. In fact, we have established a partnership with Google as of last year based on how different our AI is from other companies. Because of our AI, which integrates the full orthodontic anatomy of the patient, and what I mean by that is root, bone, and crown, so supporting structures, we lead to less refinements per case and only 6 visits to finish most of our cases. It really is something that nobody else can really offer you, just because when you don't take into consideration the supporting structures, it's really difficult to know where to place the force, and that leads to unpredictability, which leads to more refinements, right? So all of us know that patients think they're going to be in aligner treatment and even in braces treatment for a year, and it turns out to be 2, 3 years, and the patient is still going through ortho treatment. And this is because other companies or even braces are not taking into consideration the full anatomy to be able to calculate proper biomechanics. So we are all about biomechanics, and I'll explain a little bit more about that in a second. But if you don't know the length of the root, if you don't know the thickness of the cortical plate, you really don't know where to place the force, and you don't know about how much anchorage you need to use. So this is very, very basic biomechanics, but a lot of companies overlook it because nobody really has a database of cases that we have to be able to calculate this. Also, we had a great team behind this because AI is just as good as the people that are checking it at the back end. I say that most of our technicians are actually not technicians. They are orthodontists or general dentists themselves. So you're talking to a doctor who's setting up your treatment plan. And that really, really minimizes the back and forth for you to be able to get to that approval. So we offer two treatment plan options. The first one, even though it looks very similar to other companies, is a crown-based, but it's different. And I'll explain that in a second. And the second one, if you do submit a CBCT with your scan or your PVS impression, we'll give you a deep CBCT analysis, which is proprietary. You will get a bone module, which shows you the width of the cortical plate starting from the root surface at every step of the treatment plan. And you will get a root module, which shows you the real roots of your patient moving at every step of the treatment plan. Now, AI is just as good as the data is taught on. And what I mean by that is other clear aligner providers have huge AI databases too. The difference is the type of data they're feeding for the machine learning. What I mean by that is they're feeding cases that are only based on crowns. So there's no information on the root, there's no information on the bone, okay, or the supporting structures of the tooth. This leads to unpredictability because I can't think of anything else in dentistry where we don't take into consideration the root and the bone. If you think about endo, you think about perio, you think about oral surgery, pick any specialty, you are always gonna need to know more than just the anatomy of the crown. Ortho is no different. In fact, you're moving teeth throughout the bone. So it makes sense that you will need that information to lead to predictable, stable, safe results. So because around half of our cases, have CBCT feeding our database, we have been able to extract a lot of useful information from those cases. What I just said, for example, what is the average length of the root for the upper right canine? We input that into the database. That really helps when you don't submit a CBCT because we take those average, we apply it to the AI, which in turn applies it to your case. So the quality of the AI that you're getting is at another level based on what's the standard in the industry. Now, if you really have a difficult case or the type of cases that I'm going to show you in a second, and you want a tailored treatment plan to your patient, you submit a CBCT, you're going to get this amazing views that tells you, as I said before, the width of the cortical plate at every step of the treatment plan, and also the movement of the roots. Now, I want to point your attention to something right away. Our protocols care about periodontal stability and safety. So if you see here, when you look at this picture, you're going to see that there's little width of the cortical plate on buccal of this upper teeth, because red means less width. It's around 0.25 millimeters. Our protocols are set up to care about the periodontal state of your patient. So we're always trying to position those roots, torque those teeth, to give you more width of the cortical plate on buccal, because that's where recessions usually happen, especially in lower. So take into consideration that nobody else protocols are looking into that. That's the difference that 3D Predict brings to the table. It's not only about aligning teeth, it's about the full health of the patient. Now, this brings me to the American Journal of Orthodontics and Dentofacial Orthopedics latest issue, where they actually publish a study that was conducted on 3D Predict treatment planning software. This was carried out by Virginia Commonwealth University, and it was impressive. They basically show orthodontists crown-based treatments with regular standard protocols, not 3D Predict protocols, and the orthodontist rated the treatments, their satisfaction with the treatments. Let's say 50% of them, which is around that number, were satisfied with the treatment. When the CBCT was unveiled, so what carried out that treatment and the effect on the periodontium was shown to the orthodontist, it was full of dehiscence and fenestrations, because once again, if you don't know where you're moving those roots, that's what can happen too. The orthodontist radically changed their score, and they said they were not satisfied with the treatment anymore. This tells you that educated professionals that are specialists in the area that are not used to use CBCT for the treatment planning see the value in incorporating CBCT and change their treatment plan. So for example, instead of doing Vitalization or doing expansion, let's do some other movements to prevent dehiscence, fenestrations affecting the periodontium, et cetera, et cetera. This is the way of the future. More and more studies are coming out with similar results. So I really would like for you to see tonight how you can implement this in your practice to start offering your patients something that is going to start happening in the industry later on, and something that most people are not offering today. And like I said, we're partnering with Google. We are right now finishing our cases in just 6 visits with less than 1 refinement, so 0.7 usually per case. We're really excited about what our partnership with Google is going to bring for our AI protocols. So let's start talking about defining your goals. Let's start with clinical, right? And defining your goals is very important for every area of dentistry. And ortho, clear aligner treatment is no different. And you would think, well, this is very basic. Obviously, I know how to define my goals, right? Like, let's skip this section. Well, in reality, you will be impressed. I take clinical calls every week with doctors that think they know how to define their goals, but in reality, when we talk to them, it becomes very clear that because we were not taught aligner treatment in dental school, it's very hard for us to pinpoint what we want. Now, when you're talking about defining your goals, it really needs to match with patient's chief complaint and not what you think should be ideal occlusion and what you think should be ideal teeth aligning. And what I mean by that is we have been ingrained in the little bit of ortho that was taught to us in dental school that every patient needs to be class 1 canine, class 1 molar, right? And teeth need to be perfect. This is not the case. In fact, a lot of orthodontists, and I encourage you to talk to your ortho friends, they don't change class in a lot of their cases. They see that there's occlusion stability, there's no wear facets, there's no periodontal involvement, there's no TMD. So why would you try to make this patient come from a class 2 to a class 1? It really is, and I can tell you, most patients don't care about class. I still haven't met one that have come to consult and say, I want class 1, right? They don't see that far back. We all know that. So we need to reframe how we're thinking and actually start aligning to what the patient wants and what we know it's stable for the patient. Obviously, if you're seeing there's occlusion issues, right? There's wear facets and everything else that I just mentioned, then you might have to have a deeper conversation with your patient about aligning their goals to what is actually best for them too. Also, are your treatment expectations realistic? Because not every patient can be a class 1, and we're going to see that in a second. And let's talk about case complexity too. So this is what I was saying. This is a class 1 to the left, class 2 to the left, and you're getting them to a class 1. This takes distalization is a longer movement. It's a difficult movement to achieve. Can 3D Predict achieve it? Absolutely, but it's gonna take longer. So is your patient willing to go to more aligners? Maybe they are, maybe they're not. But if you look at this patient on the right, this patient is a class 2. Are we correcting class? We're not, because it doesn't need to be corrected. Everything is stable. Patient doesn't care about class. Let's just align those anterior teeth. And this is not to say everything is about aesthetics, because you're gonna see in a second it's not. What I'm trying to pinpoint here is that we need to reframe how we're thinking. Now, this is a very nice case, very nice result, right? You can see open bite for this patient, severe crowding, right? This is from a journal. You can look it up. It's open access if you take a picture at the bottom. But I want to point your attention to this, where this really realistic expectations. If you see this blanching of the tissue at the end of ortho treatment, and there's more than one study on this is the root eminence. There's no bone coverage for this patient. So there's just gingival tissue covering that root. Eventually, in 5 to 10 years, that gum is gonna follow the bone, the gingiva is gonna recede, and they're gonna end up at the periodontist chair or at your chair as a general dentist, asking you, what can I do about the super long tooth, right? That now I have, and I don't know why. And sometimes these patients need periodontal surgery and other periodontal interventions. Now, why is this not being talked about as much as it should, right? Because it's really rampant. It's because orthodontists are really not seeing this in their chair. It happens, like I said, 5 to 10 years after ortho treatment. So periodontists and you are seeing this. But let's try to prevent it, because once again, you are gonna end up seeing this patient if you're the one who followed their clear aligner treatment. Now, with that being said, this patient could not accommodate this amount of expansion and proclination. They didn't have the anatomy for this. This type of case will be great for a CBCT case. We really need to see how much supporting structure the patient has. What is the width of the cortical plate? Can they accommodate all this expansion? Patients don't have unlimited bone. They really don't. And the amount of remodeling, the jury is still out there with that one. There's a lot of studies that even question if it even happens during ortho treatment, talking about the cortical plate, not the alveolar, right? So we account for 0.25 millimeters during our treatment plans, which is very conservative, but we really need to be on the conservative side, thinking that the remodeling is really not gonna happen to a major extent. Now, if you think about it, you see this patient, if we were gonna get the patient into a perfect overjet, perfect overbite, this patient can't really accommodate this. We will be causing the hissings and fenestrations in almost all their teeth. So this is why CBCT is crucial for this type of patient. If you look at this patient on the left, you can see right away, this patient doesn't have the supporting structures, the bone, the alveolar housing to accommodate a class 1 perfect overjet, perfect overbite. This is another picture from a journal. And in this, you can see this is a patient that finished ortho treatment. You can see a little bit of tissue blanching, not that much, not as bad as I showed you before, or not as obvious as I showed you before. But when they raise the flap, they notice, wow, there's a lot of bone recession on this patient that was just hidden. And this patient actually needed periodontal intervention. They were not expecting this, to be honest with you. So with that being said, this is the result of our expansion, of our proclination, of orthodontic treatment that is not controlled. Now, talking about case complexity, every aligner company has predictability limits, and 3D Predict is not different. We actually have a table, you can see it here, where we say, for example, we know the predictability limits for the rotation of canines is 40 degrees, which is a lot. Rotating a canine even 20 degrees is hard. Us giving you 40 without needing rubber bands or anything else, it is really taking up a notch based on the industry standards. But with that being said, having this type of table that we can even give it to you, you can find it on our website, we can guide you to it, is really useful because it helps you figure out, well, I know I want to open the space for this implant this much, so how much distalization or mesialization can 3D Predict actually give me? But obviously, as we learn more about clear aligners, we may not have those concepts that clear in our mind from the beginning. So you can always get a clinical call with me, and we're ahead of the designing team, which is an orthodontist, and we can help you and guide you with this. Obviously, if you have a case like this, you will know right away. This case is complex. I highly suggest you don't submit this case for your first 15 to 20 patients, if ever, especially not without a CBCT. Now, talking about case complexity, we see a lot of doctors submitting cases with there's periodontal involvement. There's a lot of questions about, hey, my patient has still a stable perio. Can they be treated? My patient has missing teeth. Can they be treated? Absolutely. There's a lot of studies saying that patients with stable periodontitis can undergo safe orthodontic treatment. And missing teeth really doesn't deter clear aligner treatment. With that being said, right, when you start treating a periodontal patient, even if they're stable, and this is an unstable patient, by the way, even with all that recession, the rules of the game change. The center of resistance, so where we're going to place the foot, because there's less bone coverage, right? So now the center of resistance changes. Where we're going to place the foot changes. And you really need to keep that patient under surveillance. The strict hygiene, surveillance, and clinical surveillance. What that means is they need to come for the cleanings, and you need to check that the periodontitis is not being reactivated because of the orthodontic treatment, because it can happen. So you will have to see these patients more often than other patients, and you need to start accounting for that, because every time you see that patient, you're not charging them per appointment, right? So it's chair time that you're not going to get reimbursed for. Is it worth it? You are the only one who can answer this, but you need to know what you're getting yourself into with periodontal patients. Also, if the patient is missing a lot of teeth, we may need to do some adjustments. And we sometimes, if they're missing a lot of teeth, because we need anchorage, we need other teeth, right, to anchor ourselves to move the rest of the dentition, we may not be able to treat them. So it's important to keep that in mind. Now, I want you to show you this case, because this is a very complex case. This case, and it's complex for two reasons. First, because the case per se with severe crowding, right, and also the periodontal situation of the patient on lower anterior, it is complex, but also because the doctor had an idea of how she wanted to treat this case that just didn't align with what was possible. What I mean by that is she didn't want to do extractions for this very severe crowding, as you can see here, and she didn't even want to do IPR. This was just not possible to treat. If the case was outside of predictability limits, we actually pointed out to the patient, to the doctor, and we let her know. And you can see here, this is the roadmap for your case. This is the report. Everything that is in red is outside of the predictability limits. Actually, we let the doctor know about this, and we said, doctor, something's got to give, right? So either we extract teeth, we do IPR, but if not, there's going to be a very unpredictable treatment that may take refinements. In turn, it's going to take longer than your patient wants. It was actually a very long treatment plan with a lot of trays also, so which can cause patient burnout. So the doctor decided to just not proceed with the treatment. And that's the beauty about 3D Predict 2. One of the main reasons why I work for this company, We are honest with you. We will sit down with you and we will tell you, doctor, these are the options that that are feasible, that we can achieve together. If those are not aligning to your goals or your patient chief complaint, then perhaps we need to rethink the plan of action. But there are going to be certain moments where, based on that information, you may not want to proceed. And we rather you not proceed if you don't feel comfortable or your patient doesn't feel comfortable, because we don't win anything by not setting you up for success. So we talk about the clinical goals. Let's talk about a little bit about the financial goals, because I wish we had a finance class in dental school. There's a lot of classes that we should have had. Unfortunately, we don't. So now we need to learn on the run. And with clear aligner is no different than with any other treatment. But it is unique in the sense that you are seeing the patient for a longer period of time than with any other type of treatment that you may be rendering to your patients. So you need to start thinking differently, right? So I would say try to shoot for cases that are 1 year or less, because 1 year or less really is going to make your profits remain stable and make you profitable. Because if you see cases for more than 1 year, you're not going to charge the patient more. So every time that patient sits on your chair, your profits go down, 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 and you might even end up in a negative. So that means that less complex cases to begin with, until you get used to aligner treatment in general, or you get used to our system if you already have a lot of clear aligner treatment experience, are better to begin with. Because the more complex cases lead to refinements. That's a given. And also, we need to start reframing how we think about aligners. Like I said before, aligners are not just for aligning teeth for the sake of aesthetics. They are a tool that you need to use for other treatments that you want to render your patients. So talking about the length of the case, this is a table that is very useful just to have in hand, because some doctors have asked me, well, I don't know if I should submit for a predict short case or I submit for a deep CBCT or predict full cases, right? So 14 aligners or less, that's predict short, or 15 plus aligners. Now, when you have the patient on the chair, you may want to adjust your pricing based on how many aligners you think you're going to need. You can always reach out to us and we'll let you know. But also, this table is very useful, and you can actually find this table in your doctor's portal under manuals. It is actually called Select Your 3D Predict Case. There are certain things that will jump at you right away. For example, do you need to align midline? If the answer is yes, it's not a predict short case. We can do it in less than 14 aligners. Aligning midline is not something that can be achieved in so little aligners. Do you need extrusion? Do you need to correct open bite, deep bite, cross bite? All that is predict full or deep CBCT. So 15 plus aligners. So just as a general guideline, it's good to have this table at hand. So when you see a case and you know, this is an open bite case, okay, definitely I need to submit for a deep CBCT predict full case. So refinements, right? So refinements are all the extra trays that you were not accounting for. And the problem is not the extra trays. The problem is the extra appointments that you're going to have to see the patient, right? That you could be seeing other patients. So you're losing revenue twice. You're losing revenue of the case that you already charged the patient for, or you're losing revenue of any potential patient that could be occupying that chair at that time. So Chris Benson, who is a very notable financial expert for orthodontists. He actually gets invited by the American Association of Orthodontists every year to speak to orthodontists. So he's very well respected in the industry. He actually came up with these numbers in 2022 based on a Gauge survey that said that for orthodontists, the average amount of refinements per case is 2.5. And the average amount of visits per case is 12. That accounts for all the refinements too, right? Which brings revenue per visit to 431, and you can extrapolate your own numbers here based on how much you're charging, right? We run our own numbers internally, and we determine that we have 0.7 refinements per case, so around 1 refinement per case, which brings the visits down by half, which brings your revenue up so doubles your revenue. It's just basic math. So the less refinements that you have, not only the less aggravation that you're gonna have, the happier the patient is gonna be because you finished treatment on time, the more you're gonna make per case. Now, these are numbers from one of our customers who has been working with us for many years. He's actually a general dentist who has a family practice and does a lot of implants too. So we compare, right, how much he's net profiting implant per crown per case, and how much he's profiting in every treated per case, per visit and per case. And as you can see here, is very similar to how much he's making per implant and crown case. What really impressed me is that when I show him these numbers, he said, this is actually not fair. And I thought he was gonna tell me, well, because implant and crown, I make more. He actually said to me, I can even compare 3D Predict to implant and crown because implant and crown is a surgical procedure. So I have to do surgery. That takes me a long time. Every visit is at least 45 minutes forehanded. Okay? And then I have all these follow-ups with the patient if something hurts and et cetera, et cetera. And they need to come back for an emergency or just to be reassured. With 3D Predict, you don't have any of those issues. There's no emergencies. There really aren't. Nothing that we can truly call an emergency. We average 6 visits, and most of your visits are just gonna be about giving the patient the next aligner and making sure it fits. So it can be done by you, by one member of your staff, maybe your assistant, just insert the aligner, check it sits, the patient feels good, send the patient on their way. So it is a complete game changer. He said, I think I'm making more with 3D printed cases just because I am getting more chair time for other procedures with other patients. Now, how you can refine your mindset to incorporate clear aligner treatment outside of aesthetics, outside of class 1, right? Because I get doctors every day telling me, oh, I don't have any aligner cases. I don't know what to submit. You have aligner cases every day in your practice. You just need to start looking at your patients differently. So for example, how many deep bite cases you get per month? I get a lot. I see deep bite all the time. Now, what is your conversation with those deep bite cases? I'm gonna be honest with you, my conversation was nothing. Unless I saw wear facets on lowers, something that really worried me, which already is happening maybe when the patient is 30, 40 years old, right? Maybe I'll have a conversation with them. But unless the patient brings it up and tells me that, oh, my deep bite, which they probably never do, okay? I'm not gonna have that conversation about, hey, let's do something about your deep bite. But we should be having this conversation because deep bite is a very, very very common problem for patients, and it can lead to severe issues down the road. They can destroy the lower anterior teeth, including the supporting structures, right? Cause TMD because of that. Tooth loss even lead to a lot of other treatments as endo, crown for those teeth. Why wouldn't we be discussing this with our patients and trying to prevent it? Before we didn't, as general dentists, we didn't have the option of treating these cases in our practice just because doing deep bite correction is not easy. But thanks to 3D Predict and our AI, you can actually treat deep bite cases in your practice with no rubber bands, no additional appliances, very minimal refinements, if any at all. It's a new world of possibilities, and it's a new tool that you should be using with your patients just because it's good for the patient. Now, if you are placing implants in your practice, I would say 3D Predict is one of the most useful tools that you can employ. Just because when you get this tilted molar, which is very, very common when after you lost lower first molar, right? This is what happens. And the patient comes into your practice. They don't think they're coming into your practice for you to tell them, oh, now I need to do crown and root canal on the second molar. And then after that, I will be able to place the implant. They just start thinking upcharge. And beyond that, why are you going to touch my healthy tooth and put me through a root canal that patients just are fearful of? Even if they have never gone through one, they hear their family, their friends talking about it. It's a much easier conversation to present aligner treatment to them and to say, I can reposition this tooth that is tilted in a healthier position for your tooth to make space for my implant in just 4 months, because this is how long this case took for us to be able to reposition the smaller. And not only that, you are doing a service to yourself too, because for you, or for those of you who place implants, we know that root parallelism is very important for long-term stability of that implant. And here, you're just addressing the crown once again, right? You're just addressing the crown when you put a crown on this tooth to open that space, but you are not making the rules parallel like in here. So it's a win-win situation for you, for the patient. And if you tell a patient it's only going to take 4 months, I can assure you a lot of the patients are going to go for it. Do you do prosto in your practice? I'm guessing a lot of you do crowns. Once again, this is a very difficult case. And this is just to give you a very extreme example. I actually showed this to a prostodontist and he said, yeah, this is challenging because the patient doesn't have anterior deep bite, but they have a severe collapse posterior bite. And not only that, there's really little tooth structure to be able to even prepare those lower molars to place a crown there. So what are your options here? There's really not that many unless you refer to prosto or you do something very complicated that you may not have even been taught during dental school. So with 3D Predict, we were able to open that space by intruding those posterior teeth in just 5 months. No rubber bands, no mini screws, no headaches, just a trace. Perfect. Now you don't need to touch that tooth further, compromise more of this tooth structure, maybe end up in root canal. You can just place your crowns and the patient is happy and you are happy, making your life easier, right? So this is once again, numbers from real customers. This is the same dentist that I showed you before. Remember I told you he is an avid user of our aligners, and we consider him a very, very profitable user just because he submits a lot of cases. To us, a lot of cases is 2 per month. You think if you can find 2 cases per month within your patient roster, where you can say, hey, I can open the space for the implant, I can make space for my crown, I can treat this deep bite, I can align this teeth. There's more than 2. But just because he's submitting 2, that's 20 cases per year, he's making a gross profit of 128K. If he was gonna submit 3 cases, he will be making 238K. So you do the math based on what he charges, it is profitable to do aligners. We just need to start thinking differently about it. So let's talk about your ideal started aligner case, because we talk a lot about setting your goals, your financial goals, right? What does the ideal aligner case look like when you're just starting? Even if you have aligner case experience, but you need to get experience with our system. We're a little different. We're easy to use, but our technology is unique. So this is ideal. Mild to moderate crowding are great to start. With that, I want to say, it's always important to ask your patient, have you had orthodontic treatment before? Whether it's aligner treatment, whether it's braces, it doesn't matter. because then it's not mouth to mother crowding, it's a relapse case, and that puts it in a different category. You're going to understand what I mean in a second when we are almost done with our presentation and we're talking about CBCT versus non-CBCT. With that being said, if you have a non-relapse case, so a patient who had never had orthodontic treatment, and they have mouth to mother crowding, these are amazing cases to start to make your life easier. Now, once again, what are you treating? This case was submitted. The doctor said, I want the stylization because I want a correct glass. Once again, I want a correct glass. And at the end of the treatment, the doctor was not happy. She was not happy first because it was 40 steps. So this was a very long treatment plan, almost 3 years. And then she wasn't happy because there was dehiscence on lingual of upper anteriors. So she said, how can we work around this? And we actually suggested to the doctor, do you really want a correct glass? Because if the patient is stable, we can just do some expansion. That's going to bring the trays almost, cut them by half, and we can just proclaim those anterior and get rid of the dehiscence. She didn't tell us that. We suggested that. You are the captain of the ship 100%, but at the end of the day, we'll make suggestions if you allow us to make your life easier. That's a conversation that rarely happens with other aligner companies because they don't have the level of expertise that we have within our team. So let's talk about CBCT versus not CBCT. But before we keep moving, I want to stop right here to see if there's any questions.
No questions so far in the chat.
Okay, perfect. Okay, thank you. So let's talk about CBCT versus not CBCT. So CBCT, as I mentioned before, provides a tailored treatment plan. Right? If you see this treatment right here, I would say nothing major is actually happening, nothing that will raise red flags. Right? Maybe some proclination of anteriors, right? Then some round tripping, very minor. This is a standard treatment that you will get with other companies. When you look at the same case, and thankfully this patient came to a 3D provider, a 3D Predict provider, and they took a VCT, this was just very interesting, to say the least. You can see all the dehiscence and fenestration caused by this movement. This is why it's so important that for specific cases like this one, that was an ortho relapse case, like I mentioned before, CBCT is submitted. Now, if you see a patient right away that has unique root anatomy, so let's think about delacerated canine, upper canine, that is not that rare, then, or roots that are very close to each other, once again, because of ortho relapse, we don't know where those roots may have ended up, that those roots may collide during treatment. If you see any of those two things, I would suggest submit a CBCT. It's always best because we need to make sure we can create the movements that you want us to create. Now, cases better treated with CBCT, all this, we're gonna go through each and every one. But to make your life simple, because nobody's gonna remember all this, is any complex case. Any case that you know looks like it's gonna need a lot of movement, right? Or where you definitely need to know the root, where the root is, for example, for implant space making, then it's better to submit a CBCT. Severe crowding, right? Lots of movement is gonna take place. CBCT is always best. Orthodontic relapse, like I said, look at this case. It doesn't look like much. This patient had ortho treatment before, moderate crowding. When they took the CBCT, this was the starting point of the patient. As a general dentist, this will definitely change my view on how I'm gonna treatment plan this case. I will probably want a payer referral at the very least, if I even feel comfortable treating this case myself. But this is why asking that question to your patients is so important. Have you had ortho treatment before? Expansion of 2 millimeters. You see an arch that is Triangular, please submit a CBCT. If you're planning to expand a lot, CBCT is always best. By protrusion, you have a patient that you know we're gonna have to protrude upper and lower, best to submit a CBCT. You can see here how we created those movements. There were the hissings, fenestrations that were caused. Obviously, we caught them, but just as a rule of thumb, it's better to just lead with the CBCT so you don't have to have the patient back in your office and just sprung it on them. You're gonna retract a lot, patient with large overjets, right? Submit a CBCT. We need to know if there's enough bone for us to make these movements. Root torque. Are you gonna correct it by? Usually intrusion goes alongside with torque. So the seesaw effect, right, between the crown and the root. We need to know where we're positioning those roots. So please submit a CBCT. Gingival recession. This was a patient treated with Trudipredec. You see, she had gingival recession. She had stable perio. As I said before, we can treat these patients, but we need to know how much bone coverage those roots have to be able to calculate forces, right, center of resistance, biomechanics in general. So please submit a CBCT. Implant site preparation, I already talked about this. Any complex case. You see this open bite, this is complex. Extrusion is the hardest movement for implants. Can we treat this? Absolutely. The question is, do you feel comfortable with what this entails? Because this severe open bite is gonna lead to periodontal implications, so you may need an approach with your orthodontist, so have a consultation with them. It's gonna require a lot of trays. It may require more than one refinement, so you need to account for that. So can we treat open bite? Absolutely. But I suggest starting with this. For this type of open bite, we don't even need a CBCT. This was treated with no CBCT. But you see, much less severe than the one I just showed you. And we were able to just treat it within that great 1 year mark that I said, the magical year mark. So you are profitable. And there was quite a bit of movement. This did really changes patient lives. But it doesn't make your life more complicated. And like I said, don't be afraid to not submit a CBCT. Not every case requires a CBCT, but if you do have questions, please ask us. We're here to support us. We're to support you. We have the expertise to guide you whether you need the CBCT or not. So I already asked if you had questions before. Please feel free to stop me if you do. If not, I'm gonna present you some clinical cases. So this is a great case for a started aligner case, but also to not necessarily submit a CBCT. This is a patient who is a teenager that has a very deep bite. You can really make a change in the life of this patient long term, completely change the outcome of her dentition 20, 30 years down the line. You're gonna save her from those wear facets, from destroying her lower anterior teeth, just because you're treating that deep bite. And it only takes 9 months. This was done with no refinements and no rubber bands or any other appliance. You can see here, we created quite a bit of movement. And it only took 4 visits for this intrusion to take place and for the deep bite to resolve. It was very predictable. Patient was happy, but quite a bit of movement took place, even though it doesn't look that severe. With the torque, we did a lot of rotation, even 19 degrees of a canine, which is not easy, especially without any rubber bands. And we did quite a bit of expansion, especially of upper. Now, this is another case that I want to show you because it's a tricky case, right? When you first look at this case, you would say, oh, this definitely falls in the category of no CBCT. And I will agree with you, but thankfully the doctor let us know that the patient had a retained upper canine. So this patient was treated in 10 months, no refinements, no additional appliances. And this is why we ask the doctors to submit a CBCT. This retained upper canine make the whole difference. The doctor told us, oh, yeah, on the panel, I saw a retained canine. We said, doctor, because we are creating torque of those anterior teeth, and that canine is very close to the roots of the other anterior teeth, it's very important to know where we're moving those teeth so we are not causing collision with this retained tooth. The doctor obviously understood, the patient understood because the patient didn't want the tooth removed. So they submitted a CBCT. See, this type of things that I didn't mention before, obviously a retained tooth, where movements are going to be created around it, those type of things require a CBCT to give you a safe, predictable outcome. Because if we ended up moving these teeth and they are colliding with that canine, you're going to be stuck in refinements forever, and that tooth is not going to move because it's already colliding with a root. So you can see here with the torque intrusion of 1.5 millimeters, and it only took 3 visits. 3 visits for how much you're going to charge the patient, and think about those 3 visits. 2 of those may have been only 15 minutes. And this is just saying we did also a lot of rotation of canines, 19 degrees, expansion of upper and lower, and some retraction, which is the reason why we needed the CBCT. Now, this is the last case I want to show you, and this is just saying, like, once again, how can you integrate CBCT in, 3D Predict into your practice, clear aligner treatment. This case was treated with no CBCT, and obviously, you get this patient with such a severe diastema in your practice, you're not going to think you're going to be able to get away with just placing crowns, right? Unless you're going to crown from premolar forward, maybe, depending on how much space you have. With that being said, this doctor was able to close the diastema enough with 3D Predict to get the patient to a great position to perform crowns and do their prosto. So use this tool. It's useful. It's needed, I will even say. I wish when I graduated dental school, I would have something like this to treat my cases. I think it would have made my life so much easier. So thank you so much for your attention. Please let me know if you have any questions. And if you want more info, you're ready to start with us. If you don't know much about us, or if you want to chat with me or anybody else on our team, please feel free to write us at education@3dpredict.com and we'll get back to you.